So this is the second part of the massage therapy. And again, by the end of this lecture, you should be able to explain the principles of massage therapy, list and discuss the effects, and also list and discuss the basic techniques of massage therapy. So we have discussed what massage therapy is, and also a little bit about the main archaeological evidence of massage, and also the 5 effects of massage. So now we are going to discuss on the basic techniques of massage. There are 5 basic techniques of massage. They are effleurage, pétrissage, friction, tappement, and vibration. So we are going to look into these basic techniques one by one. So we will start with effleurage. Effleurage is long, soothing, stroking movement using the flat of the hand. You can use one hand, both hands, or alternating hands. Movement should be slow with slight pressure. So there are actually 2 types of effleurage. Okay, one is for superficial or for relaxation, or really is actually to just spread the oil onto the body. Okay, the second is actually a deep type of effleurage where you actually direct the fluid towards the heart. This is to ensure or to increase blood circulation and also lymph flow. Second technique is pétrissage. So pétrissage involves a lot of kneading, just like how you will knead a dough, you knead the muscle. So this focuses on a certain muscle at a time to increase blood supply to that area and also lymph flow out of that area. So these are also movement of pétrissage where you roll the muscle and also picking up the muscle and releasing the muscle. So this type of technique do not need to use lubricants. Light kneading will tackle the top muscles and firmer kneading will work on the deeper muscles. So the pétrissage technique will actually also help break down congested tissues and also help eliminate the waste products. The third basic technique of massage is friction, where friction is actually a connective tissue massage. It employs deep pressure, mostly talks about circular motion, which should be penetrating, either static or moving rotations. You can use thumbs, fingertips, elbows, or even knuckles. And there are actually 2 types, which is transverse and longitudinal. So this is a type of friction massage where it follows or elongates on the muscle using the fingertips. Or the circular motion that you do on the muscles. Like such. Or you can even do it this way, using your knuckles. This will be the static movement where we make sure that the pressure penetrates into the muscle. So friction massage really is actually looking for the trigger points that actually makes muscle spasm, or you have stiff muscles and so on. So the 2 types of friction massage is the transverse type, where the thumbs of the fingertips stroke in opposite directions, and also the longitudinal, where you can have the pressure or the rotating or the circular motion along the muscle. So the 4th technique is tappement. So tappement is actually fast and stimulating percussion movements, where you, while doing this technique, you have to make sure that your hands and wrists are relaxed. As you can see that she focused on the thigh thighs and the buttocks. So because this type of movement can actually tighten up the soft tissues. This is a cracking type of abdomen. And next she will show you the cupping type. I think this is a cupping type of abdomen. And you can also have punching or even pinching. So when you do abdomen, you have to make sure that you do not use this technique on bony areas, any broken bones, or even varicose veins. And this is what it means by varicose veins. So the last massage technique is actually the vibration technique, where it is actually a rapid shaking technique or even rolling a limb between your hands. So this is to increase blood flow, and also it can provide systemic invigoration of tissues. So this will be an example on how vibration massage is done, where you rapidly shake the muscle. Or you can roll the limb in between your hands. So that is the 5 basic techniques of massage. So a massage procedure in one session would include usually all the 5 techniques, but the procedure would usually begin with effleurage, and then you have the pétrissage, and also the circular friction or trigger points. And you can also do vibrations at the trigger points, and you finish off with effleurage again. So with the massage therapy, you just have to make sure that you never massage right on top of the spine. So I hope you get all the 5 basic techniques of a massage, and we will continue our discussion in class.